So happy Earth Day, everyone, and welcome to today's meeting of the Public Health Work Group of the California Climate Action Team. Thank you for taking time to join us. The meeting is co-organized by the California Department of Public Health and the California Air Resources Board. Our Public Health Work Group meetings are designed to provide a forum for public health partners and other stakeholders to learn about and discuss timely issues at the intersection of climate change and health equity. My name is Dan Wu, and I'm speaking to you on traditional Miwok and Nisinan territories, and I serve as the team lead for the CDPH Climate Change and Health Equity section. And I use he, his, him pronouns. So at CDPH, we work to assure that California's actions to prevent and prepare for climate change improve health, equity, and resilience. Our mission is to build health equity, improve living conditions, and advance climate action through policies, systems, and environmental changes. I'm joined today by Linda Helland, Chief of the Climate Change and Health Equity section, and Bonnie Holmes-Jen, Chief of the Air Resources Board's Health Exposure and Assessment Branch. I'm also joined by Amanda Hooker with our CDPH team, who will be running the Zoom meeting and advancing our slides for the presentation. So today's discussions will center around the state's Climate Action Plan for Transportation Infrastructure, otherwise known as the CAPTI, and how we can further align our transportation infrastructure investments with state climate, public health, and social equity goals. Next slide. So before we begin, just a few housekeeping items. For this meeting, we've muted all attendees, but we encourage you to submit any questions you might have through the chat feature, which you can find on the bottom of the Zoom controls bar. We'll attempt to address as many questions as we can, but if you have any questions or comments we're not able to get to, please feel free to send them after the meeting to climatechange@cdph.ca.gov. Real-time captions should be provided today, and you should be able to find the subtitles or some sort of function along the bottom of the screen. And we'd like to remind presenters to speak clearly and at a measured pace for our captioners. Next slide. So this meeting is being recorded, and we should post our recording online about a week or so after the meeting. We'll provide this link in the chat as well. And with that, I'll turn it over to Bonnie to share some introductory comments from CARB. Let's see, Bonnie, are you on the line?
Sorry about that, just getting everything working. Thank you so much, and good afternoon, everyone. Just wanted to share a couple of comments. So I'm the branch chief for the Health and Exposure Assessment Branch at ARB. Happy Earth Day, everyone. And I'm pleased to join you to join Dan in welcoming you to the meeting. As we launch into this discussion about the CAPTI and land use and transportation issues, I wanted to remind you of some important research efforts that are underway at CARB to promote health equity and sustainable communities. And I've just got a few of these key areas on the slide. And I'm just going to give you a very quick snapshot, lightning round snapshot of some of the work that we're doing on physical activity. Very important area. We know that physical activity results in a broad range of chronic disease reduction. We'll be talking about some of this later today. Reducing heart disease, reducing hypertension, colon and breast cancer, diabetes, depression, dementia. And as we're working to develop sustainable communities with more options for walking and biking, these benefits will grow. And we're pleased that with tools like the Healthy Mobility Options tool that we developed together with CDPH, we're excited that we can see the high level of benefits with even very small increases in activity. On green space, we're doing work on green spaces to support sustainable communities by bringing together important research, showing the benefits of spending time in natural areas, and we're documenting the physical and mental health benefits. We all know we feel better when we spend more time outside. And we're working with researchers to fold these findings into a tool to calculate the range of benefits that we can achieve and be able to share those with policymakers and the public. On expanded health analysis, we're developing more comprehensive ways to evaluate the health benefits of air pollution reductions through our rules and our regulations. And we're soliciting new research contracts now to help with this goal. And on investigating and reducing disparities, we're addressing health disparities in many ways. One study we're about to begin will look specifically at respiratory health outcomes near rail and port sources in Southern California, and quantifying impacts from communities that are more highly exposed to these sources and comparing them to those with less exposure. But on sustainable communities, we're also soliciting a new project to identify strategies that state and local governments can use to address inequitable planning and funding policies. So there's a wide range of efforts. So we're pleased that our research is supporting efforts to transform communities to cleaner, healthier, more resilient communities. And you'll be hearing from Jennifer Gress later today about CARB's, many of CARB's key strategies in this area. So I'm going to turn the discussion back to Dan. And again, welcome and thanks for sharing the lightning round with me.
Thank you, Bonnie. And I will actually turn it over to Linda, who will introduce our lineup of speakers.
Thank you, Dan. Thank you, Bonnie, for kicking us off. Glad to be here with you all today on this Earth Day. I'd like to introduce Dr. Mark Starr. Mark Starr was reappointed by Governor Newsom in 2020 as the Deputy Director for Environmental Health in the California Department of Public Health. Since 2012, he has led the Department Center for Environmental Health and is the designated State Environmental Health Director. And before I turn it over to Dr. Starr for a few opening comments, I'd like to take this opportunity to thank him for his last 20 months serving as not only the Deputy Director for the Center for Environmental Health, but also for our Office of Health Equity as Acting Deputy Director. He's done an outstanding job. Particularly, we are very grateful for his leadership in the area of climate change and health equity. It's been a real joy and pleasure working with you, Dr. Starr. Thank you so much for your service, and I will now turn it over to you for some opening comments.
Thank you, Linda. Thank you for that. Thank you. And it's been my pleasure to work with Office of Health Equity and planning to continue to do so. So I'd like to welcome everyone to the meeting today and really thank you for joining us and listening in. Hopefully it'll be a productive and inspiring meeting. Also, kudos to Dan and Linda and our climate and health team in CDPH, and also to Bonnie and the Air Resources Board team for putting this meeting together. On this Earth Day, we learned that global temperatures have reached 1.2 degrees Celsius above pre-industrial levels, which is an ominous milestone that underscores the importance of the transformation of energy, transportation, land use, agriculture, and other systems to be carbon neutral. And just yesterday, we've heard strong commitments moving toward a carbon neutral economy in the United States from President Biden, a refreshing change for all of us. It is critical that we do all of this with equity at the forefront and with an equity frame for resource distribution to communities that have faced disinvestment in the past. Climate change cannot be successfully addressed without addressing systemic racism, and I want to affirm that the lives of Black, Indigenous, and other people of color matter to us in public health, and they matter to this administration, as I think you all know. To quote our Health and Human Services Agency Secretary, Dr. Mark Galley, after Tuesday's murder verdict in the George Floyd killing, he said, "What matters most now is that we keep pushing forward toward racial justice. We all have a role in our own programs and work to advance the principles of equity. It isn't sufficient to only stand against racism, but to transform our work to actively combat racism." And all of this is in the midst of the worst pandemic in a century, which has further exposed the disproportionate impacts of systemic racism and poverty on health. So that's part of our work today, discussing transportation in California. I think we're all familiar that air pollution from vehicle emissions also disproportionately affects communities living closest to major roadways and those sources of pollution. Those are often people of color or low-income communities. Past highway construction decisions were connected to structural racism often, and those literally split neighborhoods, usually low-income communities of color, resulting in lasting health, economic, and other impacts to residents. The cost burdens of vehicle ownership and maintenance are felt disproportionately by low-income households. And across the US, people of color, low-income communities, and older adults are disproportionately killed in traffic collisions. In California, pedestrians and cyclists make up an increasing percentage of total traffic injuries and deaths. However, there's evidence that when safe infrastructure for walking, cycling, and public transit are provided in under-resourced communities, people of color often experience greater improvements in health outcomes, thereby improving equity. I think we all know that the transportation sector is the largest emitter of greenhouse gas emissions in the state, contributing to climate change and its impacts on the health of Californians. In 2018, the Resources Board produced a progress report on California's Sustainable Communities and Climate Protection Act. And that report concluded that emissions from California's transportation sector were continuing to rise, despite increases in vehicle fuel efficiency and reductions in carbon content of fuel. And the state is at risk of not meeting our greenhouse gas emissions reduction targets without significant changes to how communities and transportation systems are planned, funded, and built. This also puts California at risk of not attaining important public health, equity, mobility, and other benefits associated with reduced driving that we've just discussed. And of course, it's true that last year, in the midst of the pandemic, as California instituted the early stay-at-home orders, we did see substantial decreases in how much people drove. But since then, and as the state continues to reopen, we have seen driving levels and greenhouse gas emissions rebound. In order for California to meet its greenhouse gas emissions reduction goals, along with achieving many of the associated health and equity benefits, it's important to work towards vehicle electrification and low carbon fuels, but also to vigorously pursue measures to reduce people's need to drive in the first place, including investing in land use, transportation, as we'll talk about today, and infrastructure improvements that facilitate walking, cycling, and taking public transit to meet daily needs. So today's agenda of the Climate Action Team's Public Health Work Group focuses on California's Climate Action Plan for Transportation Infrastructure. It's an opportunity to share the state's vision to aggressively combat and adapt to climate change while supporting public health, safety, and equity. We have a distinguished panel of speakers for you today who will present on different aspects of how state transportation infrastructure investments can further align with and help meet California's public health and equity goals. And we will have a demonstration of the Health Mobility Options tool later in the agenda. And lastly, we want to hear ideas, questions, and discussion from you all in the Q&A session at the end. Before we get started on all of that, I would like to introduce our new Deputy Director for the Office of Health Equity. As you heard from Linda, my stint as acting Deputy Director has ended, and that's because we have Dr. Rohan Radhakrishna, who has joined us in the Office of Health Equity as the new permanent deputy. He came to us from Contra Costa Health Department and Health Services, been there for several years. He also has a lot of international public health experience, including with the Norwegian Refugee Council and UNICEF as a public health consultant. He's worked as assistant to U.S. ambassador at the Doctors Without Borders. He's also worked for Ecuador's Ministry of Public Health after being a Fulbright Scholar. So we're really pleased to have Rohan with us, and I'll pass the microphone to him to say a few comments about his perspectives and what he's bringing to this group and to the Office of Health Equity.
Thank you, Dr. Starr. My name is Rohan, and I stand for love, dignity, and transformation. We know environmental exposures cause disproportionate death, disability, and disease built on the legacy of structural racism. I saw this every day as a family doctor in the Richmond-San Pablo area, working over the past 10 years. And I'm done prescribing inhalers and medicines for heart, lung, and other forms of acute and chronic disease that are exacerbated by the choices we've made and the systems we've built in the past. I'm humbled and honored to join you in this upstream partnership to improve our environment and the health of people. As a local health officer in Contra Costa and a former co-chair of the Health Equity Committee of CCLHO, the California Conference of Local Health Officers, I want to thank this work group for all of their partnerships and resources and tools that have assisted local health officers like myself. All of this has helped us to advance a narrative of the health benefits of decarbonizing our economy and democratizing power to put investments in the right places to undo the injustices of the past. In Contra Costa, I had some local health experience applying SB 1000 to our county general plan update and the climate action plan, and also was pleased to serve on the steering committee for AB 617 in collaboration with our Air Quality District and the California Air Resources Board for community air monitoring and pollution reduction. The Office of Health Equity is dedicated to supporting the California Department of Public Health, the California Air Resources Board, and all agencies and community partners, local and state level, through our climate change and health equity section and our health and all policies and racial equity team. We're here to advance anti-racism and embed racial equity into all aspects of state and local government and support that. So it's my pleasure to join you today. Thank you.
Thank you, Dr. Radhakrishna. We are so happy to welcome you to the Office of Health Equity, and we look forward to working with you to democratize power and with communities across the state to further health equity. Next slide, please. Now I'm pleased to introduce our first panelist for today, Darwin Musavi, who will speak to us about the California Action Plan for Transportation Infrastructure. Darwin has served as the Deputy Secretary for Environmental Policy and Housing Coordination at the California State Transportation Agency since 2019. Before joining the team at CalSTA, Darwin held various roles at the state of California, such as Sustainability Project Manager at Caltrans and Program Manager of the Affordable Housing and Sustainable Communities Program at the Strategic Growth Council. Darwin earned his Bachelor of Science in Environmental Policy Analysis and Planning from UC Davis and a Master's in Urban and Regional Planning from Portland State University, with an emphasis in transportation planning. Please get us rolling, Darwin. Next slide, please.
Thank you so much, Linda, for that introduction, and to Rohan and Mark, thank you so much for those introductory comments and remarks that I think set the stage really well for the conversation that we're going to have today. I'm really happy to be here and have the opportunity to talk about the Climate Action Plan for Transportation Infrastructure that CalSTA has been working on since the release of an executive order in September 2019. Yeah, really excited for our discussion today. So with that, I'll just dive right in here. And again, I'm Darwin Musavi, the Deputy for Environmental Policy and Housing Coordination at CalSTA, and my portfolio includes working at the intersection of transportation and land use decisions to further our climate, health, and equity goals in particular here at the state. So next slide, please. So the Climate Action Plan for Transportation Infrastructure was born out of the Governor's Executive Order N1919 in September of 2019, which called on various sectors in the state to double down on taking various administrative actions to further our climate goals. Amongst the various things that the executive order calls for was a call for our agency, CalSTA, to leverage over $5 billion of annual state transportation spending to help meet the state's climate goals. And it specifically called on us to do so in a way that helps move our infrastructure investments towards funding infrastructure that encourages transit use, walking and biking, finding innovative ways to reduce congestion and encourage mode shift from cars to other modes, and to support infill development, and all of this under the frame of trying to reduce vehicle miles traveled, and to ensure that we do all of this while accounting for increases in transportation costs that may be incurred by low-income Californians to make sure that there aren't inequitable outcomes from our various policies that we put forth. And although this is all framed in the executive order around climate change, as we're here to discuss today, the outcomes of this work and the significance of this work goes well beyond climate change in terms of benefits and impacts to our communities. The mode shift that can occur here through how we shift our investments is, I think, a really key step in positioning our transportation climate change goals to also work on reducing inequities that particularly transportation access inequities and access to economic opportunity that come from our transportation system, while also increasing or improving public health through providing people with access to more active modes of travel like walking and biking, and also providing them with options to move away from being dependent on a car, which promotes a sedentary lifestyle that folks have no option but to opt into if they do not have other high quality options for travel. Amongst many other impacts that we'll talk about moving through this in a bit. Next slide, please. So the executive order specifically mentioned, as I said earlier, $5 billion in transportation spending that the California Transportation Agency and our partners such as the CTC, the California Transportation Commission, and Caltrans play a role in either scoping, recommending, or selecting projects through. And this is the list of the various programs, state funding programs that make up this $5 billion. For folks who aren't familiar with these particular programs, these are various funding programs that local or regional governments and sometimes states, the state itself, apply to for funding. As you can see from the various names, the exact mode of transportation and a statutory aim of these programs all differ. And this effort isn't necessarily meant to change those statutory aims of these programs, but instead working within these programs to figure out how do we get better climate outcomes and better health and equity outcomes with our investments in each of these programs. If, for example, we're talking about solutions for congested corridors and solving for congestion, how are we doing that? Are we doing that in a way that can help improve equity and health and climate? And how do we make sure that those types of solutions are prioritized within these programs? Next slide. So in order to implement this executive order, we've taken on a robust stakeholder engagement process since the executive order came out to build this climate action plan for transportation infrastructure, which is our roadmap for implementation of EON 1919. Right now, where we sit is about a little less than a month out from the end of our public comment period. So we actually have a draft climate action plan for transportation infrastructure that was released at the beginning of March, and it can be found on the CalSTA website. And I believe I have a link at the very end of this presentation as to where you can find the document. And we're taking public comment right now until May 19th. So very much encourage folks to review the document and please, we do welcome your input. So looking forward to receiving input from all of you. Next slide, please. So the plan itself, just a bit of an overview of its frame and what it intends to do. CAPTI includes a holistic framework for, as I mentioned, aligning our infrastructure investments with our climate, health, and social equity goals, built on the foundation of a fix-it-first approach that was established with SB1, which was the increase of the California gas tax in 2017, which brought new revenues to the transportation sector, transportation infrastructure sector. And so what we mean by this fix it first approach is that our priority for investments will continue to be in maintaining and maintenance and rehabilitation of the existing system. And when we're talking about climate change and maintaining our roadways, a fix it first approach is actually pretty critical to our climate, health, and equity goals, because if we approached our system from an expansion standpoint before first making sure we're taking care of our maintenance needs, there's certainly a big question there as to whether we're practicing true sustainability if we're not thinking about the long-term maintenance implications of those expanded roadways before ensuring that we have the funds to maintain them first. So fix it first will continue to be a pillar of our work. There's, in addition to that framework, the document provides a set of proposed changes to state transportation planning, programming, and mitigation activities to align with the CAPTI framework. And so we'll go through that framework here in a bit and explain that a little bit in greater detail. And we're aiming to do all of this while acknowledging that the outcome we're seeking is to ensure that all areas of the state can benefit from changes, and that acknowledging that the range of solutions will look different in different contexts. I think this is really critical for the plan's success, to ensure that the transportation solutions we're talking about and what's needed is broad enough for different contexts, and that urban, suburban, and rural contexts in the state, various geographies are able to find solutions that work within the framework. Next slide. So as I mentioned, the plan includes an investment framework made up of 10 guiding principles, which we'll go through here in a bit. And then there's an outline of 7 strategies and 30 actions, which are our initial areas of work that we plan to undertake to help implement those guiding principles that we've laid out. And I'll touch on some of that briefly here as well. Next slide. So diving into the investment framework and those 10 guiding principles, which are kind of at the heart of CAPTI and our vision for transportation infrastructure investments moving forward. These are 3 of the 10 guiding principles. I think of these 3 as the what in terms of the transportation modes that we're actually looking to increase investments in and focus our investments and prioritize our investments in. First, we want to work towards building an integrated statewide rail and transit network. This is key and critical in our efforts to reducing vehicle miles traveled across the state and providing people with a key option to be able to opt out of congestion, opt out of driving a car, and have an alternative network across the state for how they travel. Next, we want to invest in safe and accessible bicycle and pedestrian infrastructure. As was highlighted earlier in the introductory comments, we know that the bicycle and pedestrian safety and safe infrastructure and completed networks are key to improving access to active transportation. Vulnerable road users on the road, bicycle and pedestrians, are at greater risk of severe injury or fatality on our roadways. So this is critical from multiple aspects from a public health perspective to make sure that we're investing in these networks. And then in terms of addressing air quality and climate for vehicles that we know will continue to remain on the roadway, we want to make sure that as we work towards our zero emission vehicle goals as a state, that the transportation infrastructure projects that we're building are including and thinking about investments in light, medium, and heavy duty zero emission vehicle infrastructure as part of those larger roadway improvements that we might be doing. Next slide, please. And so these 7 other guiding principles that will guide our transportation infrastructure decision making are what I view as the how, and essentially, as we build our transit network, our bicycle and pedestrian networks, our zero emission vehicle charging infrastructure network, how do we do it in a way that gets us to those health, equity, and climate outcomes that we're aiming for? And that's what these are about. So first, we need to be thinking about and strengthening our commitment to social and racial equity by reducing public health and economic harms and maximizing community benefits in our projects. And I'll talk about a little bit detail here in a bit with some of the strategies that we have in terms of how to do that. But this is really about ensuring community needs are embedded in the projects, and that we're connecting to and raising community voices in project decision making. Next, making safety improvements to reduce fatalities and severe injuries of all users towards zero. This is important and key in terms of how we approach safety. In the transportation sector, safety has always been and I think will continue to be a key reason we put projects forward. But we need to start thinking about safety really specifically and prioritizing a certain set of safety projects. I think traditionally in the transportation space, safety is framed in terms of overall collision reductions and not necessarily thinking about direct health and safety impacts to people, to individuals as being at the forefront. This is certainly something that is already happening, but we want to put a greater focus on making sure that our priorities around safety are really around Vision Zero goals. Next, it's important as we think about reducing our climate impact that we're also preparing and building a transportation system that really accounts for the physical climate risk that our communities are going to be facing in the future, particularly when we talk about vulnerable communities that are vulnerable to climate change. And so how are we accounting for our changing climate in our infrastructure decisions? Next, important, I think, flip side to building our bicycle, pedestrian, and transit networks are also making sure that we are not promoting projects that will further significantly increase passenger vehicle travel, and ensuring that we aren't funding in highway capacity projects that could induce additional vehicle travel, particularly in highly urbanized and congested areas. I think are key and critical for our air quality improvements that we are looking to achieve. Additionally, we think our transportation projects should be built in a way that promote compact infill development while protecting residents and businesses from displacement. Traditionally, we think about land use decisions as coming first, and being what leads the development of a community, but transportation projects can have a huge impact on what type of land use may come in around it, and what changes in terms of displacement that may occur of residents, or the type of development that may or may not occur depending on the design of a transportation project. So I think it's incumbent on us to think about those impacts as we design projects. And the flip side of that is protecting our natural and working lands, and thinking about our natural and working lands when we build transportation projects. Oftentimes, transportation projects can actually lead to changes in the built environment around them, their ability to kind of unlock and bring better transportation access to lands that may be at pressure for conversion to more urbanized uses. And then finally, as we work towards deploying our zero emission vehicle infrastructure, particularly from a goods movement standpoint, we need to be thinking about zero emission freight in particular. And given the major freight impacts that vulnerable communities and disadvantaged communities in the state face, and I think thinking systemically and from a freight transportation system standpoint is going to be really important to really moving the freight sector towards a future. Next slide, please. And so as we take those 10 guiding principles, we've come up with a set of 7 strategies under each of which are embedded very specific actions that we plan to take at the Transportation Agency with our transportation partners to bring those set of guiding principles to action and to work towards implementing or having our transportation project decisions reflect those guiding principles. And so I won't go into these in detail, but just to give folks a sense of the types of actions that we're talking about here, I'll touch on a few of these. Number 2 in particular, we're really interested in putting further investments in transit and zero emission vehicle deployment and in actual transportation investments as a pathway to economic recovery. I think this aligns very well with the American Jobs Plan that the Biden administration has proposed. And we're looking to leverage those federal funds as well as explore how we can maximize state funding to focus on these areas. We're interested, as listed in number 3, in elevating community voices in how we plan and fund transportation projects. As I mentioned earlier, one action that we're proposing in particular is an Equity and Environmental Justice Advisory Committee that would work across my agency, Caltrans, and the California Transportation Commission, essentially the 3 state entities that deliver statewide transportation infrastructure to advise us and give input into our processes on how to get better equity outcomes in our planning and programming efforts. And then, I think another important piece of this to acknowledge is that there's a lot of work happening at the local and regional level on these issues, and there has been for a really long time. So we've as listed here, number 6, we have listed out specific actions in CAPTI that seek to support and leverage existing local and regional efforts and come up with ways that this work we're doing at the state can be complementary and supportive of those efforts on the ground. And finally, as mentioned earlier, in terms of the importance of land use, we want to make sure that we're working intersectionally across sectors, particularly on work that's happening around housing, to make sure that our housing and transportation decisions are working in sync towards creating more climate-friendly and equitable outcomes for Californians. So we have actions listed under number 7 related to that. So just wanted to touch on a few of those things here, but there's plenty more in the action plan. There's over 30 actions specifically listed in total under these strategies on areas of work that we're pursuing. Next slide, please. So finally, before I wrap up, as mentioned, to get more information about the plan itself and to see a draft, there's our website right there. You could also just go to calsta.ca.gov and navigate to the climate action page under the subject areas tab, and that email address to submit feedback is also listed on our website by May 19th. So again, thank you so much for having me, and looking forward to the discussion and Q&A later here today. And thank you, and I'll pass it back to Linda.
Thank you, Darwin, for leading this work and for outlining the CAPTI vision for us. I want to draw folks' attention to the chat because Dan is putting resources in there that you may want to check out. And I also see that questions are coming in, and want folks to know that we're going to take questions at the end after all the panelists have spoken. So please put those in the chat. We can keep track of them, and we'll get to as many as we can after all the speakers have gone. Next slide, please. And now I'm pleased to introduce our next speaker, Naila Pope-Hardin. Naila is the policy manager at ClimatePlan, an organization with over 50 partners that work at the intersection of transportation, climate, housing, and equity. She has over 15 years of community organizing experience that spans transportation justice, racial equity and environmental justice, and climate justice. All of her advocacy is rooted in her experience growing up as a Black woman in South Sacramento, and now as a mother raising her 2-year-old son. The most important thing to know about Naila is that she believes that we can achieve our climate and equity goals through community-centered solutions, and welcomes everyone to be in community with her. Thanks so much for joining us today, Naila.
Thank you. Thank you for having me. So once again, Naila Pope-Hardin with ClimatePlan. You know, this morning in preparation to have this conversation, or not even to have this conversation, just this morning, I was talking to a group of girlfriends that are all in environmental justice type of fields. We all are women of color. And we're just talking about how we get through this week with all of the news coming down and, you know, the guilty verdict in the trial. And we were just talking about how we get through this work. And we were talking about the overt violence that many people of color are facing. And to be honest, many people of color are facing in our streets. And most of us do some type of transportation advocacy. And then we started talking about like the slow violence that happens in decision-making rooms when we take a long time to do studies or develop plans, and the slow violence that happens when we don't take our emissions seriously and communities are suffocating, communities have poor water. And then I was telling them that I had to make this presentation today and talk about CAPTI. And we were talking about just, while this plan is ambitious and has great potential, just the slow violence that we have, that it's causing, that we have to have conversations to even make this plan a thing, to even have this plan implemented. So while I do not plan on spending a lot of time talking bad about this plan, I think CAPTI is amazing, but I just want to frame it that these conversations are not even the conversations that we should or could be having. CAPTI is a bold direction, could shift California into a bold direction towards meeting our climate and aligning them in equitable way, and really making sure that our spending is actually doing what we say we want it to do. And it really has the opportunity to change the way that investments are happening, not just in the transportation sector, but it's a great opportunity to be a framework for how many agencies are moving forward in the future. So I don't mean to knock it, but I do want to just give an honest perspective, because I was told I was coming here to talk about community needs and priorities. And I also want to just take a moment and praise CALSA and Darwin specifically for the amount of work that they've done around stakeholder engagement. I mean, it has been a year and a half of having conversations around, you know, what does the future of transportation investment look like for California? And it's been great to participate in a lot of those. But also when I think about and two things you'll learn about me, and I know a couple of folks on the line or on the Zoom, but I love an analogy and I love a quote, and I'm going to give you both. So when we take it back to the verdict, right, I just think CAPTI is like the guilty verdict. It is the first step in a larger conversation about indicting a system. It is step one. And we can take a moment and we can rejoice, but we cannot look to this plan to be the end all and be all for the way transportation investment happens moving forward. So like I said, while the plan deserves a bunch of praise, from a community standpoint, some of the things that are missing or that we really want to push this plan to do and be a little bit more robust around are targets that link the strategies to greenhouse gas emissions. Because while this is a lofty plan, we're missing actual targets to link the strategies and the actions to actual greenhouse gas reductions. We need to see progress reports that show how close we are or are not to actually achieving our goals. There needs to be accountability and mechanisms to push to ensure that agencies are actually doing what this plan is meant to do. And also, we can't just find more money for this plan. We also have to really figure out how we divert money from the programs right now that are not as climate friendly, and from the programs that are inducing demand, increasing VMT, or and increasing our greenhouse gas emissions. So there's a lot of work around this plan to do, right? But that doesn't mean that we need to necessarily not move it forward or not all work together to push CAPTI forward. I think there is a lot of excitement around the language and the framework and the coordination that it's provided over the last year and a half, and just the amount of people that have been in a room talking about what equitable climate investment looks like, what reducing GHG emissions in an equitable way looks like. There's so much beauty in that. But like I said, in the same way that we're talking about the racial justice uprisings that have happened in the last year and a half, focusing on just one particular trial or one particular plan is not what's going to indict and actually get change in the whole system. So one of the things that I love about every time Darwin gives his presentation is he calls out three things about the plan: that it is holistic, because we're not just it's not just about piecemealing one particular sector or part of our transportation system. It really is trying to take a broader look at all the things transportation. It is holistic, it is a living document. I don't know if you said that one this time, but usually Darwin says something around it being a living document and is able to change. And then the third thing that I think is really exciting about CAPTI is the flexibility, right? We need a solution we need solutions that are as complex and diverse as our state. And so CAPTI being a great framework and starting point is wonderful. But we also need to have these deeper conversations about what targets look like, about how different regions are going to be able to implement these strategies, and the myriad of possibilities that are here. I think for folks that have really been studying and grappling with, transportation and transportation justice, transportation infrastructure, all of the engineers, all the public health folks, everybody, this is our time to shine, because this is where we really bring the innovation, the creativity. This is where we really can bring, all the things that we've been dreaming about for years. CAPTI is the framework that opens that up. And I think we can't just support it, but we also have to support CAPTI and then push it further and bring in those innovative ideas and solutions. So I'm gonna end with a quote by Bell Hooks, and I really appreciate Deputy Director Rohan mentioning that he comes from a place of love, because that's kind of where this quote is rooted. And it says, "A love ethic presupposes that everyone has the right to be free, to live fully and well. To bring a love ethic to every dimension in our lives, our society would need to embrace change." And so I just want to leave on that note that CAPTI gives us the ability to really shift the paradigm for the way transportation infrastructure is funded. While it is not perfect and doesn't go nearly as far as I hope it would, it begins to shift the paradigm a little, right? It begins to make us, it's the beginning change. It is the guilty verdict, but it is nowhere the solution or the conclusion. And I encourage us all to really push this document and this plan a little bit further. And I will end my remarks there.
Thank you so much, Naila, for your words. Definitely heard you. That CAPTI is like the guilty verdict this week. It's just one step towards what is really needed. And thank you for bringing Bell Hooks' love ethic to this important work. Next slide, please. Now I'd like to introduce our next speaker. Jennifer Gress serves as the Division Chief for the California Air Resources Board Sustainable Transportation and Communities Division, where she focuses on promoting policies that provide a range of affordable housing and transportation options that reduce vehicle miles traveled and accelerate the transition to a zero-emission future. Jennifer has a PhD in social ecology from the University of California, Irvine, where she studied housing and community development. Thank you for joining us, Jen.
Good afternoon. Hi, everybody. My name is Jennifer Gress. I'm Chief of the Sustainable Transportation and Communities Division at CARB. My portfolio includes a strong focus on passenger transportation, and I oversee the SB 375 Sustainable Communities Program in particular. Increasing travel choices and reducing the need to get around in a single occupant vehicle is a big part of our mission. And I'm really happy to be here today to talk about CAPTI. I'm going to talk a little bit about our work on sustainable communities and VMT reduction more generally, and then how CAPTI fits into and supports that work. Can I get the next slide, please? And one more. Thank you. So CARB has been aggressive in adopting regulations that require cleaner vehicles and equipment, but cleaner vehicles are not enough. Even with 100% of new car sales being ZEVs in 2035, 30% of vehicles on the road will still have an internal combustion engine. And there are many other reasons to build communities that support other travel options, including public health, reducing congestion, and reducing transportation costs. A cornerstone of CARB's efforts has been supporting the Sustainable Communities and Climate Protection Act of 2008, or SB 375, which made some important changes to the way we think about the connections between climate and our built environment. Under SB 375, California's 18 metropolitan planning organizations, also called MPOs, develop what are called Sustainable Community Strategies, or SCSs, as part of their regional transportation plans to meet greenhouse gas reduction targets for passenger vehicles. CARB sets those targets, and we review and determine whether those plans would meet the targets when fully implemented. The benefits projected from implementation of this program are really important. In regions like Southern California, for example, it means increasing the number of housing units and jobs located close to high quality transit by over 30% above today's levels. It also means increasing total transit miles by 24% and more than doubling bike and pedestrian lane miles compared to today. Furthermore, as this group is well aware, sustainable communities, public health, and equity are inextricably linked, as neighborhood and the built environment are one of the major determinants of health. Interventions and policy changes to implement sustainable community strategies are expected to promote health, as well as provide opportunities to address disparities in health outcomes across race and income. Next slide. So over 10 years have passed since the adoption of SB 375. In 2018, we completed a report pursuant to SB 150 by Senator Allen to assess progress in meeting the GHG reduction targets set in the SB 375 program. And this chart shows that to achieve the 2035 GHG reduction goals, we need to reduce VMT by approximately 25% from 2005 levels. And you can see that by the rightmost green dot. However, CO2 per capita emissions and VMT are up through 2016, as shown by the orange and blue lines, respectively. So it's not just that we are not on track, we are moving in the wrong direction. And we looked at a number of performance indicators to get a sense of what was going on. And some of the highlights are that driving alone remains the primary mode of travel, transit ridership is falling, and housing cost burdens continue to increase. Next slide, please. So what's going on here? I mean, the factors that affect VMT are numerous and complex. They involve decisions and investments at every level of government, not to mention cultural norms and consumer expectations. In developing our report, we consistently heard concerns about this disconnect between the factors that shape growth and development and the state's environmental, equity, climate, health, economic, and housing goals. And that is where the opportunity lies to correct course, these intersections. Our report highlights several opportunity areas that we believe will lead to better outcomes over time, which are all highlighted on this slide. And I want to really focus on this first one. A critical finding of the report is that state funding is generally not well aligned with health, equity, conservation, and climate goals. A critical test of progress on VMT reduction is whether investments have shifted in ways that improve transportation choices, especially those that make it easy for people to drive less. CARB found that the overall ratio of dollars planned to be spent on roads versus other modes of transport has shown remarkably little shift since 2008, and that we need better alignment of state funding to support state and regional climate goals. And this is where CAPTI comes in. CAPTI is a critical element of the state's response to this issue. Next slide, please. So Darwin provided a really important overview, and I'll just highlight a few of the key features here from CARB's perspective. The draft investment framework identifies guiding principles that are expected to help achieve VMT reductions. And some highlights for us are making sure that we are investing in active transportation infrastructure, promoting projects that provide choice and do not increase VMT, as well as promoting the compact growth patterns that through infill that support fewer or shorter vehicle trips and promote the use of other travel options like walking and biking. And as Darwin noted, CAPTI also includes specific actions to make progress in implementing these strategy areas. And CARB has a role in many of them to develop tools and metrics to evaluate the GHG and VMT implications of projects seeking funding from the state. Next slide, please. I'd also like to highlight CAPTI's guiding principle, strengthening our commitment to social and racial equity by reducing public health and economic harms and maximizing community benefits. It is important for all of our agencies to infuse our programs with equity and to involve communities in our decision-making progress. For us, looking at health is an important element of understanding the inequity in our state and where and how our policy work needs to shift to address these issues. At CARB, we believe we must acknowledge that we can't continue approaching equity in our work the same way we've been doing it. And then a necessary change is to not just have equity as a goal, but to center equity in our work. And we've been doing a lot of thinking about what does that mean? We know that through our history, government policies created, exacerbated, and perpetuated systems through which white, middle, and high-income populations advance their privilege at the expense and detriment of BIPOC communities, people of low income, and other underserved communities. So we begin here with a commitment to acknowledging and dismantling those systems. Next slide, please. Moving forward, CARB will be taking steps to build off the work completed for CAPTI and to expand the Sustainable Communities Policy Framework, conceptually and through concrete actions. First is the mobile source strategy. CARB will build on our work and lessons learned from the SB 150 report, and we'll put forward some VMT reduction strategies and some concepts that CARB could pursue in the next few years. And these include support actions for some of the items in CAPTI. The mobile source strategy will then serve as the launch pad for a larger interagency scoping plan update process that needs to be completed in 2022. And the scoping plan update will include actions that other state agencies as a whole can undertake to reduce VMT. And Naila, this is where I hope we can get input and really pushing CAPTI forward and building on that good work and taking on more innovative actions as a whole at the state level. And I want to emphasize that this plan isn't just a CARB plan, but we're really looking for a state plan through collaboration and partnerships with our sister state agencies and with stakeholders. And finally, we have the next SB 150 report, which is due next year. As we scope out what this report will look like, we're thinking about the type of content that would be most valuable to the regions and other key stakeholders. So stay tuned for this work. I just want to close by saying there's a lot of good work happening right now across agencies to increase transportation choices, create more equitable and sustainable communities, and reduce VMT. I appreciate all the work Darwin has done, and CalSTA as a whole, and the CAPTI, as well as CDPH, and the many stakeholders have been in this process. With that, I'll conclude my presentation. Thank you.
Thank you so much, Jen. Really appreciate your emphasis on health equity and racial equity in particular. Looking forward to working with you on this plan and other initiatives. Next slide, please. Now I'd like to introduce our next speaker, Amar Sid. Amar comes with more than a decade of experience in transportation planning. She formerly managed a leading California climate investment program of 150 transit projects worth more than $100 million on an annual basis. Amar is currently managing the newly created Caltrans Office on Race and Equity, or CORE, and has deeply rooted passion for transportation equity as it relates to the environment and community's ability to thrive. Welcome, Amar.
Hi all, thank you for having me. Thank you, Linda, for the introduction. I appreciate all the speakers that we have already had. Some great points have already been said. Happy Earth Day to everybody. This is, it's a great opportunity to have this conversation and have the discussion on today. And I wanted to highlight one particular community, Chicano Park down in Barrio Logan, San Diego, California. Is celebrating their 51st annual Chicano Park Day, where the community did active engagement and took over state-owned land to create a park, citing that they were tired of their children being hurt in the streets and that they wanted a place for community to really engage with. And they created this park and have maintained this park for 51 years. So I think that's an awesome celebration for Earth Day and for some of the public health concerns that our communities keep coming to us, especially around transportation area. So let's go ahead and get started. I'm going to do just a brief overview on what my office is responsible for and where we're kind of going with it. So let's go to the next slide. Over the last couple of years, Caltrans has really started to dive deep into learning about equity, participating in GARE, and working with our executive team to really put a foundational point around how Caltrans is going to engage with equity. And so we have the 4 Ps that most of our work is going to be centered around, not just within the core office, but Caltrans as a whole. Caltrans has 22,000 plus staff members with 12 different districts throughout the state. And so these 4 Ps are going to be enveloping most of our work over the next several years. And we have them centered around people, programs and projects, partnerships, and planet. And the way we're thinking about this is all of these kind of coalesce into how we are going to ingrain equity through the life of our work. It's going to be very similar to how we're really focusing and prioritizing safety so that everybody has a foundation at Caltrans and so that we're able to change the space and how we engage with community. Next slide. In December of 2020, Caltrans released our equity statement, and this was, again, a larger effort on the team members that I have right now, working over the course of 2 years to get this through and kind of, again, reframing it around the 4 Ps. Within the statement, the agency did an acknowledgement, really positioning and kind of following up on Secretary Kim's assessment of how our transportation decision-making and outcomes have really harmed communities, specifically Black and Indigenous people of color, and have really amplified some of the racial inequities and disparities that we have. So within the 4 Ps, we're really going to be focusing on how we can make those changes, both internally and externally, and how we partner with community. Let's go to the next slide. A very brief overview on what these 4 Ps mean. When we talk about people, we're looking at a lot of our internal components that Caltrans needs to work on. And so we want to make sure that our workforce, all of our 22,000 employees, are reflective, have the diversity, have the different abilities that are reflective of all of California. We want to make sure that our leadership is going to be reflective of the communities that we want to engage with and the communities that we hope to improve and support. We want to make sure that we are hiring and that we are providing technical assistance throughout all of the communities, especially the the communities that, again, we have not, in our acknowledgement, that have been harmed and continue to be harmed by our transportation system. In programs and projects, we really want to make sure that we're engaging to dismantle our structural racism around transportation. This is going to take a deeper dive between a lot of our different programs and divisions within Caltrans to change how we engage with community, to change our guidelines, to change all of our programs, and then how we fund projects. So we believe that we will achieve this through a lot of different engagement practices, to make sure that we're leading with dignity and justice, and in making sure that our communities have not just a stake at the table, but are actually seeing the outcomes that they actually want. So the prioritization there, we hope to benefit not just all of our communities, but taking a deeper dive into our underserved communities throughout the state. Let's go to the next slide. Our partnerships are looking at leveraging different type of partnerships and engagement. Again, this is going to be something where we're looking at internal and external capacities. We want to be able to consult with our leading CBOs and the advocacy groups that have been doing this work. We want to make sure that whoever we are working with has connection to community. We want to make sure that we are increasing capacity for economic gain through state partnerships. So we're looking at like a lot of our civil rights requirements to ensure that we're leveling up our DBE, providing more technical assistance, trying to get people onto lists for contracting, and looking at different ways to really fund and pay for CBO support within the work that we're doing. In Planet, I think this is where the connection with CAPTI comes in, and it's very difficult to do any of this work if we're not focusing on where we're going to be living and how we're going to survive through the climate crisis. So we want to make sure that we're combating our climate crisis for our most vulnerable frontline communities, and that includes Black and Indigenous people of color, communities that are experiencing like unhoused situations, and then our folks that have disabilities and our youth. So we want to make sure that our vulnerable communities have the tools, have the resources to move freely, have access to transportation that they so desire and meets their needs. And again, in a way that we're not disrupting our landscape, and that we're not perpetuating the harms that contribute to climate crisis. Let's move on to the next slide. So as I mentioned, our equity statement was released in December. The Caltrans Office of Race and Equity was created in August, and we're staffing up and trying to gear up towards all of the work that we need to do. And this kind of coincides with the recent release of the Caltrans strategic plan. Within the strategic plan, it was a pretty awesome move to elevate equity as a value and as a goal throughout the plan. So no longer having it be relegated elsewhere, it's going to be ingrained in all of the work we do. And I wanted to highlight this slide. I know for some reason it looks a little blurry on my end, but there's a couple of things in there where we're talking about community health. And for my office, we're looking at how do we want our community members to thrive? What does it look like for community members to determine their transportation modes, to look at accessibility, and how do we provide space for communities to have a space to call their own, and how can we push all of our programs and projects to do just that? So how do we look at elevating public input into the outcomes? And I want to say that through the community health aspect and vibrant communities areas, that's where we're going to be moving towards. We want to make sure we're not just hearing community anymore or documenting input, but leveling it up to outcomes and strategies that community will see what's going to take shape. They are going to know that construction is taking place, but they're going to have a hand in how that takes shape, or if we're awarding transportation projects or transit projects, that they have a stake in developing those transit projects. So looking at a space of thrivance and health opportunities. Let's go to the next slide. So these are some of the specific actions that have taken place just over the last month and stuff that we are engaging in right now. As I mentioned, the strategic plan was updated to include equity as a value and a goal. We're also moving towards our community development and training, and this is in partnership for internal work and external work. We want to make sure that my team is working hand in hand with our EEO so that we have equity enveloped in all of our hiring practices and all the training that needs to take place at Caltrans. We are a large agency, so we want to make sure that our house is in order and our staff members have the tools to actually communicate with CBOs, to communicate with the public so that we can take that information back and change how we do our work. And so our goal is to level this up across all of Caltrans. So all of our 12 districts, our team is working on a roundtable with our 12 districts about every other month or so to build out equity teams in the districts and to build out training and learning opportunities. The next area is moving up and prioritizing some of our California climate investment programs through the technical assistance in partnership with the Strategic Growth Council. So we have the Low Carbon Transit Operations Program, and we have TRCP, the Transit Interstate Rail Capital Program. They're moving in towards their second year of technical assistance, and both of the technical assistance here are a little bit different. Again, they prioritize on disadvantaged communities and low-income communities, but we want to make sure that we're partnering our transit agencies with our CBOs so that our CBOs and our public entities can really communicate the projects that they want to see going forward. With both of these programs, they have an investment target to actually benefit, and that benefit has to be meaningful and direct so that we have to tie in community engagement strategies to ensure that those projects are actually doing what they want to do. In the first round of technical assistance, one pretty awesome project that came out of this work was partnering CBOs and public with LADOT, and that project that year turned into the LA Dash to Campus or Dash to School student fare pass. So they created a free fare program that has been in existence now for 2.5 years, which has put a lot of pressure on some of our other transit agencies within the area, like LA Metro, to follow in their steps and do at very minimum free transit for our youth. The next area is prioritizing our Native American liaison branch within CORE. So we elevated this branch outside of the Division of Planning so that we can make sure that we're maintaining that government to government relationship at a high capacity. So we want our tribal members to feel valued, and so that we're elevating a lot of their work in the safety plans, in some of the strategies that they're working on, and ensuring that they have direct input into a lot of the work that we are kind of taking shape. We want to make a case that our tribal governments relationships, we have district liaisons throughout Caltrans, but making sure that those relationships are more meaningful, and then also providing capacity work for the tribal governments to engage in their own transportation plans and safety plans through some of our stakeholder engagement. Then we have the Caltrans listening sessions. This is going to be a partnership with the CTC and the California State Transportation Agency, where we're almost finished with our contract, where we hope to have 6 listening sessions held throughout the state. This information we hope to gather how, again, communities want to see their transportation system flow, developed, how they want funds to be initiated. That would then use this information to inform how we create our equity index, which you see here. And this is part of the CAPTI strategies, is creating an equity index where we are able to weigh and measure some of the indices that could determine how projects are implemented throughout the state, could give us information if the project outcomes are going to be equitable or not. And this tool, we hope that would be similar or at the same level of a CalEnviro but have some weighted importance around our transportation metrics and looking at racialized data, and be able to be a tool where the public can utilize it and see how investment dollars are coming into their place. Let's go to the next slide. that is it for me. I kind of ran through that really quickly. So I'm really excited that CAPTI is kind of moving through. There's a lot of work that the core office is engaging with throughout Caltrans in support of a lot of our strategic plans to level up how we do our equity work. We're trying to move away from it just being my office is responsible for equity, but have it ingrained throughout all of our offices and all of our planning. Thank you.
Thank you so much, Amar. That was excellent. We, in our office, we believe that we cannot have climate justice without racial justice, nor can we have health equity without racial equity. So we're happy that your office exists and look forward to working with you.
Mm-hmm.
Next slide, please. Now I would like to introduce my colleagues from CDPH. Jeffrey Rosenhall has been with the California Department of Public Health since 2004, and his current role with CDPH is as a section chief in the Injury and Violence Prevention branch, supervising and leading over a dozen staff from the Active Transportation, Violence and Injury Prevention, Healthy Aging, and Adverse Childhood Experiences programs. And Victoria Custodio, who is the health education consultant for the Active Transportation Safety Program within CDPH's Injury and Violence Prevention branch. Welcome, Jeffrey and Victoria.
Thank you so much. So we're going to tag team this presentation. I'm going to get started. Again, thank you to Office of Health Equity for including us in today's meeting. I'm Jeffrey Rosenhall from the Injury and Violence Prevention branch, and I'm co-presenting with my colleague, Victoria Custodio, who's the senior team member of our Active Transportation Safety Program. And we are honored to be a part of this ongoing discussion with you, so thank you for that. Today, we're going to highlight complementary ways that CDPH is supporting climate change work through sustainable active transportation, either directly or indirectly in this brief presentation. We're going to give a short overview of our existing transportation safety programs and share selected activities on the ground, which we think will dovetail nicely with this new CAPTI plan. Next slide. So CDPH's focus is on prevention, and our branch, IVPB, injury and violence prevention specifically is our bread and butter. And our efforts include epidemiologic surveillance, planning and consensus building, interventions, policy development, professional education, training, and public information. You can see here a list of some of our current programmatic efforts, and there's more about us on the website at CDPH if you're interested. So we're the lead branch for violence and injury prevention at CDPH, and injuries are the leading cause of death, hospitalization, and disability for people ages 1 through 44 years of age here in California. And injuries have substantial impacts and consequences for the economy, communities, and well-being of our population, not to mention discouraging non-motorized travel. In fact, in 2019, just under 4,000 Californians lost their lives, and an additional 26,000 were hospitalized in motor vehicle transport collisions. So not just those that are involved, those who are driving the motor vehicles, but also injuries caused when drivers of motor vehicles crash into others, including pedestrians, those using mobility assisted devices such as wheelchairs, and of course, the cyclists. I'm gonna pass it off now to Victoria, and she's gonna give us an overview of IVPB's Active Transportation Safety Program. And then I'll come back and talk a little bit about some of our crash data and other epicenter data projects. Victoria?
Great, next slide, please. Okay, I'm going to be very brief in my overview of the Active Transportation Safety Program. The biggest takeaway about our program is that we function as part of Caltrans Active Transportation Resource Center, or the ATRC, which serves as a virtual hub to help local jurisdictions develop and deliver walking and bicycling projects under the state's Active Transportation Program, which Darwin mentioned as part of the CAPTI framework. So CDPH is just one of a small handful of partners under the ATRC. Our team feels very fortunate to have a working arrangement with Caltrans so that our department can play a direct role in encouraging walking and bicycling, and also support state, regional, and local efforts to establish safer and complete streets that we know are essential for normalizing active travel and increasing physical activity across the state, which is so important and vital to health and well-being, both physical and mental health. So next slide, please. So our role within the HRC is threefold. We do technical assistance, training, and resource development. I know there's no time to really go into a lot of depth here, but I will say that our work has addressed a wide range of topics and tools to better ensure that public health and health equity are considered in all active transportation project planning and the selection of projects each cycle. Next slide, please. And then in the interest of time, I'm not going to speak much on this slide, except to remind everyone that ATP is the program that the HRC supports directly, and that the ATP clearly reflects the values and goals of CAPTI, and that we at CDPH would love to see this program further expanded because we know how oversubscribed it is and how it has been for years. And I want to just play off of something that Amar brought up. One of the things that we really do think would be valuable in a revise to this program is considering how the program can be designed administratively to allow for more direct funding to community-based organizations, because they're so vital for developing quality projects in the areas that need these kinds of investments the most. Next slide, please. Oh, and then I'll turn it over to Jeffrey at this point.
Great, thanks, Victoria. So I'm going to talk about CMOD, or Crash Medical Outcomes Data Project, next. And this is a program at CDPH, but it's funded through a partnership with OTS, the California Office of Traffic Safety. So CMOD, in that project, we work to better understand how to prevent Californians from being injured or killed in traffic crashes. And it involves two main focus areas. One is data development, and the second is data analysis. So for data development, we work to create a comprehensive traffic crash and injury data system by integrating data from various sources, including DMV driver records, police crash records, emergency medical services transport records, hospital records, trauma registry records, and vital stats. Together, all of these data sources provide a more complete picture of factors from pre to post crash. Next slide, please. Thanks. So just a little bit more about CMOD. So then we use these data to conduct analyses that inform prevention and intervention efforts. So we analyze traffic crash and injury data to identify trends, crash circumstances, victim characteristics, risk factors, medical outcomes, and more. And so you see here on the screen, the results of the analyses are often presented in data briefs, like the ones that we share on our website and to other stakeholders who are interested. This work is focused on preventing and reducing transportation-related injuries and deaths by steering interventions and resources where they are most needed. So, just to tie back with CAPTI and everything we've been talking about this afternoon, safer walkers, cyclists, motor vehicle operators, and roadways all encourage active travel and help reduce greenhouse gas emissions. And that's our overall goal here. Next slide. So just a note on Epicenter. So we have this fantastic query tool where we can search for injury-related deaths, hospitalization, and emergency department or ED visits in California. And we're currently working to do a major update to Epicenter's content and format. So when you go in there, you can filter and group injury data by cause, which is a combination of the injury mechanism, such as motor vehicle transportation crashes, and intent. And then users can also filter and group injury data by other variables like age, sex, race, ethnicity, county of residence, expected source of payment, and the time of death or hospital or ED admission. And one of the ways that we see Epicenter being used is to develop these county active transportation safety profiles. We're really excited about this idea. So our branch at IVPB is currently working on a template for the county profile using existing death, hospitalization, and ED data. And so in the future, we hope to also provide access to the linked data that the CMOD team develops as part of its project work. Next slide. Thanks. So we wanted to not mention another big plan within a conversation about a plan, but we did want to touch on briefly our branch's work and CDPH's role in the Strategic Highway Safety Plan, or SHSP as it's known to a lot of you. It's a comprehensive statewide transportation safety plan, and it provides a framework for reducing fatalities and serious injuries on all public roads in California. So just a note, the SHSP has 3 key leadership groups or areas. There's the steering committee, challenge area membership teams, and the executive leadership teams, and IVPB and CDPH really is involved in all three. So the steering committee establishes the strategies and processes to implement the SHSP, and it provides oversight for the challenge area teams. I currently serve as a CDPH representative on the SHSP steering committee. In fact, was just on a meeting this morning, and just want to assure all of you that the topic of equity is first and foremost, and we've been having extremely robust conversations about the role of enforcement in traffic safety, and how we do traffic safety in a way that is equitable to everyone impacted by roads here in California. And also the challenge area teams. Those are the ones really on the ground evaluating relevant data and tracking best practices related to that particular area, and are responsible for the development and completion of action items in the implementation plan. And Victoria herself is serving on a challenge area team. And then finally, our new CDPH director, Dr. Tomas Aragon, is part of the SHSP Executive Leadership Committee, and includes executives from Caltrans, CHP, OTS, and DMV, among other agencies. Next slide, please.
Sure, I'll take it from here. So we wanted to highlight 3 items that CDPH is currently involved with, that we think will help advance safer streets for walking, bicycling, and rolling, and as a result lead to more people walking and bicycling instead of driving those short distances that we know are walkable or bikeable. So these actions are also aimed at making safer streets for those that are already walking and rolling, either by choice or by necessity. The result of these actions will reflect emerging and best practice around traffic calming, speed management, public engagement, and the prioritization of resources to the most dangerous roads where there are a number of vulnerable road users. So these actions all support the SHSP's goal of really meeting that vision 0 towards 0 death and reduction of serious injuries. And then they're consistent with our active transportation safety goal, which is getting more people walking and rolling due to safer conditions. Next slide, please.
Great, thank you, Victoria. So we wanted to share just a couple thoughts or ideas, but I think we're probably close on time, but we'll have the slide up here for a couple seconds. And so these are some questions and considerations that we also just always are thinking about and wanted to share with you, such as, how can injury prevention efforts be leveraged to support sustainable transportation and climate action goals? I think that one is super relevant to the conversation and the information that earlier speakers have presented today. And then also, existing traditional motor vehicle transportation injury focus, how can we recenter that on multimodal transportation and mobility and micro-mobility? And then, we just really want to continue to engage and bring in local health departments, local health jurisdictions in the planning and collaborative approach to making safer policies and systems and environmental changes in our communities and on the ground. So I'm going to move on to the next slide, which I think is our last. There we go. Thank you. So that's the end of our brief presentation. Again, just thanks to Office of Health Equity, all the other speakers today for inviting us to be here today and speak about injury prevention and how that can be leveraged to promote sustainable communities and also increase climate change effectiveness. And we look forward to being part of the discussion going forward. Feel free to contact us, either Victoria or myself, with any questions that we weren't able to get to today. Thank you so much.
Thank you so much, Jeffrey and Victoria. Great work. You guys do so much in your branch. I hope listeners will follow up with you. Next slide, please. Great. Now I am pleased to introduce Meredith Millett from our own Climate Change and Health Equity section. Meredith is an epidemiologist in our Climate Change and Health Equity section. She works on various data resources and tools that help to connect climate change to health and health equity. Since Meredith started with our section 4 years ago, she has worked on promoting the use of ITHM model, which she'll tell you about, and in this past year has helped to set up the Healthy Mobilities Options tool for release to the public, which she will now demonstrate for you. And she's actually done a lot more than that, but don't have time to go into that right now. Thanks, Meredith. Please show us the Healthy Mobilities Options tool.
Okay, thanks. And thanks to all the speakers. It's really great to hear all of this work and leadership on linking transportation and equity and health. So I actually get to show my own slides here. Okay, someone let me know. You can see the slides. This is taking up time, but I realize I can't see the slides.
I cannot see them yet.
Oh, okay.
I just see faces. Can others see slides?
No, I think it was just showing up as a black screen. I wonder if there's multiple screen setting.
Okay.
Now I'm seeing participants.
Yeah, now it's participants. Yeah.
I'm trying to open it again. Sorry.
In the meantime, please check out the chat. There are lots of resources there. Okay. Oh, now we see that. Now we see the slide.
Okay. I think it was when I tried to put it in presentation mode. I'm not sure what happened. So I might just do it like this without it being in presentation mode, just in case. That's okay with everyone. Can you see them well enough?
Yes, that's fine.
Okay. All right. Thanks, everyone. So as you've heard a lot about from all these other organizations, our climate change and health equity section also has a key tenet of addressing climate change and how that represents a significant opportunity to improve health and equity. And transportation is a key pathway for that. So we provide this tool that illustrates that. It quantifies the health benefits and sometimes the harms that come from increasing active transportation, including how those benefits might be greater in low-income and communities of color. And the tool is called the Healthy Mobility Options Tool. It's a web-based version of the California Integrated Transport and Health Impact Model, or ISIM. And I do have a short time today, so we'll consider this a little bit of a teaser. I'll give sort of a brief overview. And luckily on the website, there are a lot of resources and documentation that you can look at on your own, and you're welcome to contact us or CARB with any questions also. Okay, so just to remind you, the pathways that are addressed by the tool, you have your transportation system, we've heard can be built in ways to increase walking and cycling and transit. That increases physical activity. Even people taking more transit increases physical activity because most people will walk or cycle to get to and from transit. And that, of course, reduces a wide array of diseases. The active transport also benefits health through reducing emissions. It mitigates climate change. And as we just heard about, it can also cause more traffic collisions. So that it should be done with safety in mind. So the Healthy Mobilities Options Tool is a scenario-based predictive model that quantifies the health impacts of different levels of active transportation. It's basically a website that runs the ISIM model, which was adapted for use in California by Dr. Neil Maislish at CDPH in 2012. Until recently, the model was available as a download of a package of spreadsheets, and you'd use it on your desktop. And that was used effectively across the state by a lot of jurisdictions and planning organizations, but there's always been a motivation to make it more accessible, and that was realized this past year. CARB's research division supported Dr. Maislish and his team in transferring the model into a user-friendly web-based version. And now it's called the Healthy Mobility Options Tool. So like I said, I'm not gonna get into the details about the model. You can read about them, but basically it takes data from a variety of sources and it uses those to make predictions for different levels of active transportation or the different scenarios that are in the model. It estimates the reductions in deaths and prevalence of a variety of diseases. It estimates the monetized savings and the reductions in emissions. It can be done for California overall or by region or by demographic factors. And one of the newer segments is estimating the outcomes by income level or race ethnicity. Right now, these are modules that can be downloaded separately and run separately, but currently CARB is also in the process of funding work to have those modules fully integrated into the site as well. There are a number of state and national active transportation scenarios that are built into the website, and users can pick from those and see what the outcomes would be, or users can upload their own data and scenarios. and run those in the application. So I wanted to just summarize some of the results that we've seen and have been published by this model. For reference, we start from a baseline in California of about 23,000 deaths per year attributable to lack of physical activity, another 5,400 from air pollution, and over 3,000 from road traffic injuries. And across the scenarios built into the ISM model, what you see on this slide are the changes in the health outcomes that are predicted. So there's significant reductions in disease burden and lives lost from chronic disease. And this is the range from across 4 different scenarios. And these health benefits on this slide include benefits from the increase in physical activity and the reduction in air pollution, but I want to point out that about 99% of the health benefits on this slide are from the physical activity part of that equation. And of course, you also see the red line at the bottom because people walking more and biking more leads to an increase in road traffic injuries. So but the model doesn't take into account all of the safety improvements that could mitigate those injuries. So we're going to do a demo of the model, but I just wanted to reiterate that this model gives us this opportunity to show how we can tackle emissions by not only switching to lower carbon fuels or vehicles, but by emphasizing active transportation and then saving thousands more lives along the way. Okay, so I'm going to open this, and actually I realized that I might have to stop sharing and share the screen with it open. Sorry. Okay, take 2. Was working for me earlier today, but I do have some backup slides to show you since I can't seem to get into the website for some reason. Okay, so this is what the website looks like on its own. And I don't know if it's worth it if Dan or Amanda can get it up and then want to switch with me, but I'll just keep going for now. And before I talk about running the model, I want to show that there's a section on decision support that shows a lot of the background research and policy options and interventions to implement kind of the what to do. And there's a huge section on user support that I don't have a slide on, but it has actually video trainings, it has all the documentation, there's a lot to do there. And it's also where you download the race and ethnicity and income modules that I was talking about. And when you download those modules, they basically look just like the website, but you're running them from your desktop in Program R and R Shiny. And you would run them, there's one for each race ethnicity, one for the different income levels. You would run them and then just compare the results for whatever you're interested in. And like I said, hopefully in the future, that'll be integrated into the website. So when you open the website, it looks like this, and I know it's hard to see, but on the left, you select one of the scenarios that's built in, and down here, it'll tell you what the active transportation levels are for that scenario. And you can choose whether you do California or a county or a region and the year of the population data you want. And on this side, it'll show you a summary. It'll tell you what change in active transportation is, the deaths that are saved from chronic diseases, the deaths that are saved from air pollution, the traffic injuries that are increased, the savings in costs, and the reduction in emissions. And you can do it for different scenarios. And then you can also click, I know it's harder to see on the slide, sorry, but you can look at tables, graphs that are down here, or this is just the top snippet of an infographic when you're on the site. It takes kind of all of the information that was in that summary and puts it in a really nice infographic in case you need to present that somewhere. Oh, and this is a picture of what the user site looks like. the user help site looks like. So I'm really excited to see work for me today. But I really hope that people get a chance to look at it on their own and spend more time. And I wanted to put up the credits here because obviously this is the work of a lot of people over a lot of time. And I'll help get us to the discussion next. So thanks very much.
Thank you, Meredith. I hope people can click on the links that are in the chat of this tool because it's really cool to play around with. And we hope that folks will use the Healthy Mobility Options tool to inform decisions about where and how to invest in transportation decisions and resources. Now we have some time for a discussion of what we've heard today. Next slide, please. So we came up with these initial questions, which I'm going to ask the panelists to first just choose one aspect of them, informed by what you've heard from other panelists today. If you could just each go around and say kind of one summary closing statement addressing these issues. Don't go through each question. And then, because we really want to hear from the audience, this is largely a public input venue on the CAPTI plan. And so to the listeners and the audience, please think about these questions that are in the screen and what answers to them you would like to see in the CAPTI. Okay, so how can the CAPTI further align with state public health goals for increasing physical activity, promoting safety, improving air quality, and more? How about with state efforts to address inequities such as structural racism? What opportunities do you see with the CAPTI further advancing the state's climate goals, including around climate resilience? So people can chat into the chat, and at first I will turn to Darwin for just a kind of summary closing response to these questions.
Sure, thanks, Linda. You know, these are all obviously great questions, and I think I touched on several during my presentation. But one piece I didn't directly address that I think is important to highlight, and several of the speakers have brought up is you know about you know CAPTI's work around addressing inequities and structural racism that our institutions are embedded in. And you know, I think fundamental to our climate action plan for transportation infrastructure and the fact that we want to take a holistic view that's really about people and the people that we serve and the transportation outcomes that they need is this sense of moving away from our transportation system as a system in and of itself that is built, you know, through communities, dividing communities, having negative impacts on communities to serve an end that is viewed as transportation, as instead, you know, flipping the script about thinking about what you know, what people need and how we can support you know, economic access to opportunity and goods and the economy and jobs through clean, healthy, and equitable, accessible transportation options. So, you know, structural racism and trying to, you know, combat those inherent inequities in terms of how our current institutions function are really at the root of CAPTI. And you know, I really like what Naila said that in terms of invoking the Chauvin trial, that this is really kind of the beginning about, you know, kind of accountability on what our transportation system could do for us, and there's certainly a long way to go, but this is our starting place.
Thank you, Darwin. Now to Naila.
Yeah, I will kind of hop on that the third question for what opportunities in advancing our climate goals. And I think really it goes to the ability to align our spending with our explicit climate goals, and to be able to, I mean, right now CAPTI doesn't necessarily do this, but the ability to link investments to GHG reduction and VMT reduction in a way that's like really meaningful is really important. I also go back to the piece where, I mean, the original intent of the executive order that CAPTI came out of was the diversion of $5 billion. And so it's not just about spending $5 billion well, but it's really about the ability to divert from all the bad and poor spending habits that we have around climate infrastructure and moving that into something that's going to be, sustainable and can help build more climate resilient infrastructure.
Thank you so much. Okay, now Jen.
Hi there. Well, specifically to the number one on physical activity and promoting safety and air quality, and one of the big recommendations in CAPTI is to find a way to increase funding for the active transportation program. And I think that's really important. I think that it speaks to the need, but it also speaks to the challenge of doing that. And so I'm very hopeful that by calling that out, we'll have an opportunity to find some funding sources, either through federal recovery efforts or others. In terms of the second point, one of the things in CAPTI that I'm really excited about is an action for Caltrans to develop an equity index to assess, transportation projects that Caltrans would undertake. And I understand that work is just beginning now, but the thing that makes me excited about it is as that gets developed and implemented, we will learn a lot that I think we can then apply to other transportation agencies. And I really appreciate Caltrans being willing to take that on, because I think it's going to be really important for projects that county and regional transportation agencies undertake and local agencies, and also how CARB evaluates projects in the Sustainable Communities program. And then finally, in the third bullet, in terms of resiliency, I think about resiliency fundamentally about options. Creating an array of transportation options that allow different communities and different households to adapt kind of when things go wrong. And you need options to do that. And I think by shifting, starting that process of shifting investment to have more options, that will help communities adapt to changing economic and environmental conditions.
Great, thanks, Jen. Amar.
This is kind of hard because I feel like all of us could talk about all three of these and want to give some space. But I think for Caltrans, or for all the state agencies, we really need to level up how we are able to fund our community-based organizations that are doing the work that we as a state agency need. We need the input from our communities. We need to pay and resource how we compensate the labor that our CBOs and the advocates provide. And so I think that's one way that we can go into number two, is dealing with inequities such as structural racism. It's like really looking at the funding capacities that all of our state agencies have so that we can pay the Black, Brown, Indigenous community organizers that show up all the time, that deliver all of the great talking points, but without resourcing our community, it's very difficult to continue to belabor them with the requests that we have as state agencies. And I think from a state agency perspective, we have to validate how we move through our work, and using our community input is where we need to do. So I think that's one way that we can kind of combat that, because it's not necessarily built into all of our entities where we can regularly compensate our CBOs and advocates for this work. And when you look at data, that qualitative data is where we get a lot of our answers for, and paying for that is something that we should be able to do. So that's kind of a way I'm thinking about like dismantling structural racism within our practices.
Thank you, Sid. Yeah, that's a structural problem that we have to deal with at the state, how to recognize the time and wisdom of community partners. Jeffrey.
Yes, yeah, and I agree that we could speak to all of these 3 points, but won't in the interest of time. I'm going to go with the first bullet, and just as far as things that CAPTI could align with as far as state public health goals, there's this concept of zero traffic fatalities, and so if the CAPTI framework could keep that in mind, it hits a couple of the shared goals I think that I saw in the presentation and in the plan itself. Reducing communities just built around the single occupant vehicle, and that speaks to community design. Just to keep hammering on that, we still need to do more of that. And increasing active travel safety. Again, people will do it more if they feel more safe in and around their streets. And that means not just bike lanes and sharrows, that also means violence prevention and feeling actually safe to go out and walk in their communities any time of day or night. So that's an important distinction. And it also has that triple bottom line of like reducing chronic disease. And so when we reduce chronic disease, we also increase happiness and community cohesion, and people feel healthier and they're more likely to be out and about. So I'll end there and let Victoria add something.
Thanks, Jeffrey. Victoria.
Thanks, Linda. So I was just going to address the first question with hopefully some practical concepts. So, I know that CAPTI is really looking to address equity. And I want to point out that all of the good work that the public health community, the greater public health community has already been doing, that I think can, tools that can really help, help with decision making, I think should be looked at again. So specifically, I want to call out the Southern California Public Health Alliance's Healthy Places Index, which we know is a great tool that's used for planning. It's used in the ATP program. If that can, I think it's a wonderful tool. I think I saw Dr. Neil Maislish's name on the chat list. So I just want to bring that to the forefront. If you haven't already seen that tool, it's really a great way to examine equity from a health, social determinants of health framework. And then, yeah, I want to also just say that we really appreciate the Healthy Mobility Options tool that that has been revised that Meredith just presented on. I think that those two tools can really should be used to help align spending, like Naila said, so that you can really get the most bang for your buck with future investments. And then I just wanted to add that, yeah, if there's a place for funding non-infrastructure programs that really can advance public engagement and allow for greater discussion, again, at the community level, I think that that's something that I would hope to see CAPTI embracing in its full implementation. So I'll leave it at that.
Great. Thanks, Victoria. Excellent. Now we'd like to hear from you in the audience, your answers to these questions and or your questions or comments for our panelists. Please either use the Zoom chat feature as folks have been doing, or unmute yourself and ask your question or make your comment. And please specify which panelist your question or comment is directed for, and whether it's input to the CAPTI document itself, which I see we're getting some of both. And you'll also have a written opportunity to provide this input in the post-meeting survey that you'll receive. And I'll ask Dan to read the prioritized questions, and we're gonna, in the interest of time, limit each person to one question or comment. Go ahead, Dan.
Thanks, Linda. So in just trying to kind of identify some of the higher priority or, like bigger questions and categorizing, I think one question maybe to start off with, maybe for Darwin, is curious how the priorities of CAPTI were identified and what data supports these priorities. For example, VMT analyses, transit numbers, community surveys, others. Is there public access to these data?
Great question. And my longer form of my presentation includes some of that background information, but we didn't have a chance to get into that here today, so thanks for raising it. But the Climate Action Plan is based on some of the existing kind of foundational work on the direction that the transportation agency and the state are going in general, and that's based on the California Transportation Plan 2050, which provides a lot of data and analysis and can be found on the Caltrans website, and sets the broader vision for transportation in the state of California. And so the Climate Action Plan for Transportation Infrastructure, I like to think of as kind of an actionable kind of growth out of that around how to spend our investments to help meet the broader goals of the CDP 2050, which has, you know, a whole wealth of analysis that has gone into it. And then, you know, of course, the broader foundation that even the CDP 2050 is tied to in terms of meeting our climate goals is the climate change scoping plan. Hopefully that helps answer some of those questions.
Great.
Great, thank you.
Yeah. Let's see. Another question that was submitted earlier, maybe this one can be answered by Jen. So we're asking, how can we track progress and really see that state plans like the CAPTI framework is being implemented to shift funds to achieve the intended outcomes in terms of VMT reduction and some of the other goals around pollution reduction, health, equity, and so forth?
Yeah, thank you so much for that question, because it gives me an opportunity to plug the SB 150 report. That report is it's a report we do every 4 years, and we do look at a couple of dozen of performance indicators to get a sense of what changes we are seeing. So we look at transit ridership, we look at investments by the MPOs and where their money is going. So there's a whole range of things that we look at over time, and I think it's a really good resource to track some of the kinds of outcomes we're hoping to achieve through CAPTI. And we're kicking that off soon, and the next report will be out at the end of next year.
Great, thanks, Jen. And maybe we can include a link to the SB 375 SB 150 report afterwards that we can share out with audience. Let's see. So another question that's been posed, and maybe Naila or perhaps one of the other speakers can address. So the comment and question here is, for low-income Californians who have either been driven out of price or never been able to afford to live remotely close to where they work, who aren't able to work at home and just have a challenge in terms of driving a lot to where they need to go. How is the state ensuring that transportation investment policies aren't going to perpetuate longstanding inequities on low-income and disadvantaged residents where transit, rail, or bike isn't a viable mode of commuting? And I suppose the other way to frame it is, identifying these gaps, what can the state be doing more?
I just have a really short answer on this. And this is where I say that there's the beauty in CAPTI's ability to be a little bit more nimble. And when it says that it's broad and can be adapted to different regions, because different regions do have different needs. And so we need to make sure that we have, I think I used as diverse suite of options as we have folks living in California.
And if I could build off of Naila's comments there, because I think this is a really critical point and something that I want to make sure comes across in terms of CAPTI, is that whenever we talk about multimodal investments and investments in other modes, there's a tendency to think of that as restricting people's ability to drive or taking away people's ability to drive, and it's certainly not the intent of the plan. In fact, I think a plan like this and leveling other modes on a more equal footing in terms of investment can actually be really beneficial to people who have no other option but to drive. I think the best pathways we see to reducing congestion and and burdens on people who don't have other options and live in places that may not get other options very easily, is by providing people who can take other options the ability to do so to reduce congestion on the roadway. So, I think it's really important to acknowledge that these policies are good for all users of the roadway, and not just people who are not driving.
Thank you, Darwin and Naila. And I'm sorry to say we are out of time again. So I am gonna, in respect for people's time, end the meeting, but I see we have a lot of questions and comments that are yet to be answered. So hopefully we can provide those to our panelists, and perhaps, Dan, might be a way for them to respond after the meeting. And with that, I will turn it over to you for some wrap up and closing. Thank you, everybody. And thanks so much to especially Amanda and Dan for organizing this meeting.
Great. Thanks, Linda. And I'll just take a quick moment, 2 quick announcements. Air Resources Board has an open solicitation process for applying to be on their Environmental Justice Advisory Committee for the state scoping plan update process. So for those who might be interested, please email Trish Johnson to apply for that. I'll plan to send a link after this meeting with more information about the process. And then please look out for a post-meeting survey. We'd love to hear your input for this meeting, as well as informing our CDPH CalBrace project planning. Here's the link, and I'll include that in the follow-up email as well. And then with that, next slide. Again, the recording of this will be posted in about a week or 2 on the link shown, and that was in the chat earlier during the meeting. So thank you so much again for spending time today with us, and thank you to all of our presenters and panelists, and for you all for spending to this meeting with us. Have a good rest of your day.